Good afternoon to you, July. And thank you so much for joining us.
Thank you very much, Jonas.
Yeah. First and foremost, I think the number one question here is, looking at the condition that the markets are in, one begs to ask the question, who manages these markets?
Well, Jonas, these markets were built by the city of Windhoek for the vendors. And the vendors who are selling at this market, they pay fees for the stalls that they are occupying. But then when I spoke earlier to the PRO of the city of Windhoek, she said she was not yet sure, or she's not sure, whether it's the city of Windhoek who's responsible to ensure cleanliness and hygiene at this market or the vendors themselves.
In other words, the city of Windhoek is not taking responsibilities for these established markets. Is that what the PRO is saying?
Probably that could be what she's saying.
Now, in the inset, you can see that there is no hygiene at these markets. And looking at the outbreaks of different diseases that have been going on in the country, what are the chances of people getting diseases such as hepatitis E, for example?
Well, firstly, let's just look at how can one get hepatitis. One can get it through not practicing properly hand washing methods, by handling food in an unhygienic or unhealthy way. Like we saw at the market, meat is just put on the floor and there's open sewage there. And then also through the consumption of raw or undercooked meat, which is the case mostly at this market. So the possibilities are real for one to get hepatitis or any other disease at these places.
Now, we know that both these markets cater for a large group of people, especially residing in the townships. But what do they have to say about the overall hygiene of the markets?
Well, Jonas, the people that I spoke to there at the market, they are very unhappy about this situation. Because firstly, there are no proper facilities for one to wash their hands. Secondly, the meat is handled in a very unhygienic way. Like I said, where the sewage is running, you see the meat is also lying there on the floor. And then thirdly, well, there is no health inspectors, and that is the real issue there. Where are the health inspectors to just inspect this market and to ensure that hygiene is maintained at this market?
And lastly, Jai, in your view as a health reporter, what do you think should happen or should be done to promote cleanliness and a more hygienic environment at the markets?
Well, firstly, I say that there is a need to put up proper hand washing facilities with the proper sanitizers for the public and the people who are selling there. Secondly, they need to deploy health inspectors at this market. Thirdly, there is a need, the most important one is to educate the vendors on the basic of handling food and in a healthy and hygienic way. And then thirdly, let's also educate our public on how to handle food at this market when eating at these places. So that's what can be done to maintain hygiene and to prevent the spread of such diseases.
All right. In other words, the stakeholders have to put their hands together and in combating this situation.
Most definitely, Jonas.
All right. Thank you so much, July. That was our health reporter, July Nafuka, giving us an overview of the cleanliness of the open markets in the capital.